Now this is a very interesting CT scan of the brain. You can simply pause the video and you can try to find out whether there is some abnormality in this city or not. So this patient presented with convulsions, and this patient had right-sided focal convergence, means the patient had abnormal contraction of right upper limb and right side of the face. Right side of the leg was completely okay. So, as we know, the patient had right-sided conversion. We'll always look for a lesion where it is left-sided. So we know on CT scan this is the left side. If you zoom, you can see R stands for right. So this is the right side. This L is left. So this is left side. So when we very closely see, uh, where we can see is this is all ventricle. These are the two lateral ventricles. These are the occipital horn, because this is an occipital lobe. This is occipital lobe. So a quick review for the anatomy. The most important thing is these are the lateral ventricles, and if you draw a line in front of this is all the frontal lobe. This is the lateral ventricle posterior horn. Beyond this is the occipital lobe, and middle portion is the temporal or parietal lobe. So we know that this is the temporal fossa, this is the temporal fossa, middle cranial fossa or temporal fossa, and this is the temporal lobe. So this is the portion of temporal lobe. We can see this is the temporal horn of the lateral ventricle. This is the central sulcus, the largest sulcus of the brain, which divides the frontal from parietal lobe. So this is the butterfly shaped. This is midbrain, and the perfect circle below this is pons. So this is pons. This is perfect circle. This is pons. This is the pontine artery, which is in the middle. This is the pontine artery, which we can very nicely make out. And below that, this is all pons only. This is pons only, and below this is medulla. This is medulla. So behind all this posterior circulation is cerebellum. This is cerebellum. This is cerebellum. This is cerebellum. This is cerebellum. Behind this medulla, behind this pons. This is pons. This is pons. This is all cerebellum, and here the occipital lobe starts. Here the occipital lobe starts. So here the occipital lobe starts. This is all occipital lobe. So this is occipital lobe. Now what we can see in here, that bilateral or both sided ventricle should be almost normal sized. This is right ventricle and this is left ventricle. But what we can see here, that right ventricle is not that much dilated, whereas left ventricle is pretty dilated. Same thing is here. If you can see, this right sided ventricle appears small, whereas this left sided ventricle appears pretty large. So either this is large or this is small. But to come to know what is large or what is small, we need to see the brain parenchyma. So if you see brain parenchyma very closely, we can see, just compare this brain parenchyma compare with this. So we can see that there is a radiolucency. The radio density is pretty less here. So this all blackishness is not here. And this is the sulci. These are the sulci. And this is all brain material, where the brain material here is very much less. This black means there is nothing. This black region where the CT scan rays are passing means X-rays are passing. This is appearing black means there is nothing, means this is an empty area. This is a vacant area. Brain was supposed to be here, but brain is not there. So here also there is radiolucency, means basically ideally there should have been brain, but the brain is not there, means the brain is damaged here. So if we can simply trace it here as well, we can very clearly see that the brain parenchyma is significantly lesser in this area. There is radiolucency, so that automatically this ventricle expand on the left side. So in short, this is a basically an old insult. This can be new insult as well, but in the new insult there you will not be able to see this much of ventricular dilatation, because the brain parenchyma won't disappear or degenerate within hours. So the brain material has significantly damaged, and these sulci are so much prominent. There is radiolucency, there is significant atrophy of the brain parenchyma here, because of the, most probably, as this is a area of MCA territory. So most probably this patient had left MCA infarct earlier, which caused significant brain injury, significant brain parenchymal loss, which caused the secondary dilatation of the left ventricle. So when we know that the brain is damaged there, it means definitely there is a scar here. So if such patients present with typical focal convulsions, as this is left-sided brain parenchyma, and the patient presented with right-sided face and right-sided upper limb convulsions, means this is totally fitting into the left brain lesion. So convulsions with a old damage goes in favor of a scar epilepsy. So this old damage of the brain parenchyma is all scar, and this scar can definitely cause convulsions. So we have our diagnosis that the patient has left MCA territory infarct, causing brain parenchymal loss, causing a scar, and causing convulsion. So it is a scar epilepsy, and such patients are this patient must be compulsorily kept or anti-epileptic drugs for rest of their lives, because these patients will definitely have lifelong chances of getting convulsions again and again, and definitely antiplatelet for preventing the recurrent strokes. So for now this is all, and thank you.